So the first thing to do when we start scanning is to just go and select a preset. So this is the probe icon, which allows you to set and choose from different presets which are in the machine. If you don't already have an aesthetic preset or a face preset, the best way to start is just go to a musculoskeletal preset and then press enter, and that'll change the settings of the ultrasound machine to suit musculoskeletal scanning. Then we're going to adjust the image as we go. So we get a bit of gel on the probe. We're going to start by scanning the lower face. So one of the best places to start on the lower face is just to have the transducer in line with the mandible, like this, and if we put it on the screen here, we can see the masseter up towards the ear, and then if we come back down anteriorly, we can see the DAO. So we're going to make some adjustments because this is not, it's a bit too deep, so we can come in a little bit more shallow. So we use the depth button. So just rotate the depth knob until we come in nice and shallow. So we can see everything a little bit more clearly now because it's closer to the surface. So what we're looking at here in this area, we're going to have, I'm going to press the cursor button here so we can point. We're going to have the DAO muscle at the top here. Next to the DAO, we've got this little branch of the facial artery. If I come back down closer to the mandible, we'll also be able to see the DLI, which is this muscle down in here, and then underneath that we can see these bright semicircle structures here. There's the teeth. So in this area, if we want to have a look at where the blood vessels are, all we have to do is press CF for colour flow. So pressing CF, that brings up a box. Move the box to where you expect to see the colour flow, because it will only show up colour within that box there, and then you can see it pulsing as it goes. You can also put a centre line on the screen so that you know where that artery is in relation to your probe, because the probe also has a centre line on it like that. So if you take colour flow off, you'll see down the bottom here it says centre line. Just rotate the knob underneath that and that'll give you a centre line. The other thing that you can do if you want to adjust the image is you can change the frequency or the focus position, dynamic range, by using these buttons along the bottom here. So if I wanted to increase the frequency, so basically increasing frequency usually gives you better resolution, and it can decrease your penetration a little bit, but it gives you better resolution. So that's how you do it. You just rotate the knob underneath where it says frequency. So now I'm at 16 megahertz and we can see the image nice and clear. So we've got DAO, we've got that little vessel there that we saw before, that's the muscle, these are the teeth, and then we come up here and we can have a look at the masseter as well. So you can see that thick white line above the masseter muscle, and then we've got the mandible down here as well, and above that this thick white line, which is this mass, we've got the subcutaneous fat. So can you please clench your jaw for us a few times? See if you can see that masseter contracting. There it is. So you can see that whole muscle in between the bone and the fascia contracting. So that's the lower face. So again, just starting through the masseter and coming down to the DAO and the DLI, which sits a little bit anterior to the DAO there. And then if we want to just have a look at the chin as well, we can put a little bit of gel on the probe, center the probe over the chin, and in the middle of the chin, just like this. So we're going in cross section here. In the middle of the chin we have usually some fibrous fatty tissue, and you can see that that's this white, let's see if I can center that a bit better, this white structure here. You get this fibrous fatty tissue, you can see the bone of the chin there, and then on either side of that fibrous fatty tissue we usually have the mentalis muscle. So you can also have a look at the colour flow on the chin, and we can have a see if we can see if the vessels are midline or if they're off to the side somewhere. So we put the colour flow on. I like to adjust the frequency of the colour flow up as high as possible, so that goes to 6.2 on this machine, and I take the PRF down quite low, especially when you're looking at the chin, because the vessels can be very small and difficult to see. We'll pop that over the chin there. And the other thing that you can do with your colour on the chin is you can increase the gain. So I'm just going to rotate the gain. That increases the overall colour signal. can see. Just turn your head back to the middle for me. So we've got the location of that artery right there underneath the chin. You can see it pulsing in the middle. And now I move my marker here back into the center line of the chin, and we can see the location of that artery is just a few millimeters off to the left-hand side. And we can see, if we go down a little bit further underneath the chin, we can see the other one on the right-hand side too. So if you're having trouble finding the arteries in the chin, best to just drop down and go underneath the jaw like that. So coming back across here, the other thing that you can see in this area, of course, is the facial artery itself. So if you want to have a quick look at where the facial artery is, that usually comes up over the mandible here. I can see it over there. And I'll just put that in the center again. There it is, perfect. All right, now let's take a look at the mid-face. So if you bring your head back a little bit this way, I'm going to take the collar off for a moment. Actually, just rotate back this way. I'm going to do, first spot we do is just off to the side of the nose. Okay, so in this area, in the middle of the screen here, we see the piriform space. So this is the piriform space down here, and we can actually see some previous dermal fill-up in this area. We've got the fatty tissue above it as well. So that's the maxilla bone that we can see, that bright white structure that's running down the length of the transducer. And that dark area is HA filler. And let's just have a quick look with the colour flow. We might have to turn the gain down a little bit now, but we can see the location of the angular artery. And if you have any difficulty finding that, then just sweep the probe back and forth along this area, and then hold still when you see the colour signal, which we can see there. So we can see the location of that angular artery above the bone and above the area where the filler is. So that's the midface. We can also come then a little bit lateral until we see the, take that collar off, come a little bit lateral until you see this gap in the bone here, which is the infraorbital foramen. So if I come across from here to here and back, see that little, I'll put it in the center of the screen, this little gap in the bone just where my cursor is. And you get some reverberation down below it, this white line. That's how you know you're in the infraorbital area. We put the colour back on. You might be able to see the infraorbital artery coming out of there as well. There we are. Okay, another area to look at is the temple. So with the temple again, we're just going to keep moving the transducer up the head here, and we will put the transducer a little bit oblique in between the zygoma here and the temporal bone. So let's take the collar off for a sec, just so we can see all the layers. So we've got the temporal fossa here. Can you just clench your jaw a few times? You'll see actually just open and close the jaw, it's probably easier to see. The temporalis muscle sliding. So we've got temporal bone, temporalis muscle sliding, deep temporal fascia is this white line here. Then we've got the fat pad just above it, and we've got the superficial temporal fascia above that. You can see all those fascia lines. And then to have a look at the colour, you usually want to have your probe a little bit oblique like this, probably coming just off the edge of the eyebrow here. And we can put the colour flow on and look deep, and we should be able to see, which we can see here, the location of the anterior branch of the deep temporal artery and its proximity to the bone. And then if you want to as well, you can bring the colour box higher, and you want to be looking above. Sometimes you need a little bit more gel for this, because we want to be looking above the superficial temporal fascia. Now sometimes it does help with this to just tilt and rock and angle the probe. above the temporal fascia. I'll put it in the middle there if I can. Can't quite get it in the middle, but you can see that superficial temporal artery just to the left of middle. And it's probably around about here with that centre line. So if you're happy with all the presets, once you've done that, all you have to do is go into the probe button again, and you can select up here, configuration, and you can copy, so you copy to, and rename this as a aesthetic preset. And just press tick, and that'll save all of the changes that we just made to the frequency as well as the colour. And if you want to save any of the images as you're going along, you can just use the P1 button here, and that will, so I'll exit this menu. If you use the P1 button here, this will save any images directly into the patient file. And if you want to create a new patient, you can either press the patient button here, or you can come up to the top here, press that and just enter a new patient, and all of that will be saved into the machine.